Good evening, everyone. I hope our audio and video is fine. Can you just give us a thumbs up if the audio and video is fine? Yeah, I think it should be okay. We're just waiting for the students to join. And today's session, we're going to talk about that a lot of messages that I have got in the last few days about the students, that what they should do now. And since they have got a 2.5 month extra, so how they can utilize this opportunity of taking an edge and able to handle the subjects and as well as the time in a big way. Some of the students have told me that since the time they have heard this announcement that the exam is postponed, they are unable to study because now suddenly, because they have planned it in a way that they have to do it till 12th of March, and now they have a time. So I believe that all that matters is a focus and a correct discipline. Any student who is able to finish the subjects on time and able to do revisions is definitely gonna come out as a winner. And please do not think that if you have got an extra time, it is to enjoy. The extra time that you have got is for extra revision, so that wherever you are thinking ki okay, this you are unable to do because of the lack of time, you will be able to do in a much bigger way. Okay, before I start talking about, I have worked very hard today, spent almost 3 hours in sorting it out, the schedules for you, and which I will be discussing for you in this entire session. But before I start, I would request Dr. Nachiket to give his opinion about what is his thought about that how a student should utilize the time. Over to you, Dr. Nachiket.
Sir, I think you have covered most of the points, but I'll just add on a couple of myself. I think the probability of the thing happening most right now, since the exam is delayed for like a couple of months more, is that procrastination will set in. Every day you are going to get up and you are going to wonder कि आज क्या करना है और क्यों करना है, बहुत time है. And that बहुत time will suddenly, it will be like 15 days only, because that's the time when you start actually wake up and realize कि एक महीना निकल गया and I have not done anything. So you have to plan your every day to the limit of every hour, so that at every step that you have to motivate yourself. Nobody is going to come to you. I mean, we can try at our end. You can listen to as many faculty videos as possible, but at the end of the day, every morning, it is you who has to get up from the bed, bathe and sit at that desk and start yourself. So that particular thing needs to come from inside you. हम तो सिर्फ एक जरिया हैं, करना आप नहीं है. And I think sir has put a lot of efforts in making that particular schedule. कि यार finally, you will have something in your hand. And I think if you just follow that, अगर नहीं है दिमाग, बहुत जगह पे नहीं होता, ठीक है? So दिमाग बंद रखो, just follow करो, इतना भरोसा कर लो. I think that would be enough. Yeah. So I think just follow what sir is saying, and you will be able to do that. So Chief Mentor of DBMCI.
Nachiket, I think you rightly said a point, and I want to slightly elaborate on this. कि हम तो एक जरिया है. A lot of time people ask that, sir, do we really need coaching, and do we really need anybody? So I always say that, see, there is a river, and you want to go across the river. You can very well swim and go across the river. I mean, obviously you can do that. There is no doubt about it. What we try to do is we try to provide you a boat through which you can cross the river in an easy way. That's all. Now, if somebody says that without the boat, can you cross the river? The answer is yes. Obviously, you can do that. Okay. So that is the whole idea. And that is the whole principle and the whole philosophy that we believe in. And I sincerely request the people that, see, if somebody is determined, focused, and disciplined, they don't need anybody else. The only thing that they need is books. But unfortunately, we get deviated. And in this world of social media, when the informations, once they reach to you, are so much distorted. Now, by the time that they have reached to you is so much distorted, then it has obviously become very, I will say that people get drifted, people get distracted. Okay, all right. So without wasting...
Sir, I'll just add one more point. And what we are talking, we are not gods, for first of all. We might be right, we might be wrong. it is up to you what you follow. I mean, if you are following us, then follow it with full heart. I mean, आधा मत करना कि आधा मैंने
Exactly.
ये ले लिया, आधा वो ले लिया और एंड में खिचड़ी मत के फिर हमें गाली दी। नहीं, हम नहीं है वो।
Exactly.
या तो
And
पूरा
stay
करो या मत
positive,
करो।
and stay positive. Whatever that is happening for the good. If you are honest, if you are true to yourself, the things is gonna come in line. And it's totally your choice. You want to trust us, very good. If you don't want to trust us, still we are not, nobody is forcing you to trust us, है ना? I mean, कोई आपको जबरदस्ती पकड़ के ये वीडियो नहीं दिखा रहा कि प्लीज ये बैठो और इस वीडियो को देखो. It's totally your choice whether you want to see it or whether you don't want to see it. But please remember, please stay positive in life, because the moment you will live with positivity, you will gain more. And then from wherever you are reading, you will definitely gain more. Your brain will imbibe the things in a right way. So we don't want negativity. You want to see this video, you want to learn about it, it's very good. You don't want to do it, please switch it off. Go to, you can attend any other session, you can read your book, you can watch a video on the Netflix. Nobody's stopping you. But please, no negativity. We are positive people and we want to remain in a positive mindset. Okay. All right. So without wasting much of our time, please see. Now, I will consider myself that I am a student who is writing the exam. Okay. I was preparing for 12th March and suddenly I got this information that my exam has been postponed for 2.5 months. Initially, I thought, okay, chalo, बहुत अच्छी बात हो गई है. My exam has been postponed for a 2.5 months. But now suddenly I'm thinking, कि यार मैं करूं क्या? मैंने तो अपनी जो preparation थी, that I have prepared like 12th of March. What should I do? At one point, I'm saying, can I do something in a good way? So now what I'm going to do is, please remember, the way that you are preparing, please consider that the up to 15th March, if you are already enrolled, 15th March, 15th February, the way that you were enrolled in any course, if the exam was happening on, I will say that 12th of March, majority of the things were finishing by 15th of February. So please consider 15th of February, if you had some backlogs, you will complete the backlogs. If you have pending visual videos, please complete those visual videos. Like in DBMCI, we have got vibe. So if you have not done the vibe, complete the vibe by 15th of February, at least one reading. If you have already completed the vibe, you have not completed your booklet, quickly revise the booklet. So up to 15th Feb, what you have to do is, you have to complete your backlog of the subjects. Plus, you have to complete your backlog image-based videos. It is not mandatory for you to go with the vibe. You can go with any image-based videos that you're looking for. If you're doing vibe, I'm just telling it to you. Okay. Then a GT. Write one GT. And if you have some QBank pending, try to do as much as you can till 15th of Feb. So the schedule that I will give you from 15th of Feb, and from 15th of Feb till 21st of May, which is the current date for the NEET-PG, we will do 3 revisions. If somebody is starting from today, and if you ask me, sir, can I still crack the NEET? I will say definitely you can still crack the NEET. A lot of people were messaging me, sir, this 2.5 months has come as a welcome thing for me. I had almost given up. I only want to qualify. Can I qualify? The answer is 100% yes. Even if you are at 0, please mark my word, I should not say this word. Even if you are at 0 and you want to crack the exam, you will be able to crack the exam, provided you read for next time that is available. Okay. So what I have done, Dr. Nachiket, can I share my screen?
Yeah, sir.
Okay. Thank you. So I hope my screen is visible. Dr. Nachiket, is it visible?
These are, it's visible.
Okay. All right. So if you're going to see, what I have done is I have divided my subjects into 5 categories. Now, if you see it, ultra long subjects, very long subject, medium subject, and short subject. In the ultra long subject, I have kept medicine and surgery. In the long subject, I have kept OBG, PSM, pathology, and anatomy. In the long subject, in the very long subject, I have kept OBG and PSM. In the long subject, I have kept anatomy, pathology, pharma, micro, and biochem. In the medium subject, I have kept physio, pediatrics, ENT, and ophthalmology. And in the short subject, I have kept radio, derma, ortho, psychiatry, anesthesia, and FM. Now, what we will be doing, if you're going to see that, first I will break my days from, if you're going to see, from 15th of February to 21st of May, if I consider I have 96 days. Video isn't clear, बच्चे video तो clear होना चाहिए. I don't think there should be a challenge. Okay, just change the settings of your YouTube probably, and then I think it should be clear. So if I consider from 15th of February to 21st of May, we have got 96 days. What I'm going to do is I'm going to do my first revision for 50 days, which is going to be up to 5th of April. From 6th of April to 7th of May, I'm going to do my second revision. 8th May is the AIMS exam or an INI-CT exam. And from the AIMS exam to the NEET-PG exam, I'm going to do my third revision, which is from 9th of May to 20th of May. In this, I am going to write grand test. I am going to do subjects and different way. So first of all, these are the subjects. I have divided the days to these subjects. For an ultra long subject, I have 5 days. For a very long subject, I have got 4 days. For a long subject, I have got 3 days. For a medium subject, I have got 2 days. And for a short subject, I have got 1 day each. Okay, that is the days that I have divided for it. Now, if you're going to see it, now first reading, second reading, AIMS, and the third revision, I have tried to incorporate the grand test in between them. Okay. Now, what I have done is I have decided that what will I read in this particular subject. So in a particular subject, it totally depends that where do you stand at this stage. If you have already attended some classes, if you have already during your MBBS read pretty well, and you have the notes available for a particular subject, only 3 things should be done for that subject, and that is notes, images, and questions, period. Notes, images, and question. These are the only 3 things that you have to do. Now, in the notes, the one that you have prepared, images, an image-based session, and the questions, minimum questions that you have to do is previous year MCQs. Previous year MCQs of that particular subject. There are a lot of books available in the market for the previous year MCQs that you can use for it. But these are the 3 minimum things that you can do. Now, the challenge that can happen is you do not have a notes for a particular subject. What to do? If you do not have a notes for a particular subject, in these cases, you can rely, and as I told you now, you can swim across the river. But if you want a help, there are boats available. So use those boats, and these boats will help you in sailing you from one end to another end. You can use, now you cannot cover it from the entire complete video lecture. Then you have to go with short courses like LMRP program. Last minute revision program can help you in this. There are many other programs that are available. You can rely on them also. But please make sure that in these 5 days, you will have to do these 3 things. Don't think कि चलो मैं 5 दिन सिर्फ वीडियोस देख लेता हूं और इमेजेस को और क्वेश्चंस को भूल जाता हूं. No, that should not happen. There should be a proper guidance. Ideally, if your theory is strong, it should be 1:1. If your theory is not very strong, it is 2:1. Now, what is the meaning of 2:1? Let us say you are reading 12 hours in a day and your theory is not strong. Then 8 hours theory, 4 hour MCQs. If your theory is strong, then 6 hours theory, 6 hours MCQs. So as your theory will keep on getting strong, the amount of time that I will give to theory will keep on decreasing. The amount of time that I will spend on the questions will keep on increasing. Okay. So notes, images, and questions. These are the things that you're going to do. Okay. Now, the biggest challenge that most of the people face is that which subject should be done when. Now, the problem that happens is that no matter what we say, it is a stress to read. You have to make learning in a way that it is not becoming monotonous. Okay. So what I have done for it, I have created a schedule for you on the basis of this, which is ultra long, very long, long, medium, and short. Now, if you're going to see that, we will start from 15th February with ENT. We will do ENT for 2 days. We will do anatomy for 3 days. Then we do short subject, which is radiology. Okay. Then we're going to do surgery for 5 days. So what I am basically trying to do is, I am trying to do a long, short, medium, long, very long, a combination of that, so that the life is not getting monotonous. If I'm going to just put surgery and medicine together, it will be difficult for me to remain in the track. Okay. So I've created it in a way so that you are reading a medium subject, a short subject, a long subject, a very long subject. So we can start with ENT, then we can go with anatomy, radio, and surgery. It is basically a clubbing. Then we're going to write a grand test. We're going to write a grand test on 26th of February. 26th of the February, we're going to use only for the grand test. We will analyze the grand test for the whole day. Then 27th February, we're going to start with Dharma, 1 day, ophthalmology for 2 days, pathology for 3 days, anesthesia for 1 day, OBG for 4 days, physiology for 2 days, and FM for 1 day. After that, again, I'm going to write a grand test. What I am doing is, after doing every 3 or 4 subjects, I am analyzing myself that am I showing an improvement? Please remember, this improvement is your own improvement. It is not your rank. You should be a better version of your past. I always say that what you have to do is, you have to be a better version of your past. If you are scoring 100 correct, is this GT? It should be 120 correct, 110 correct. Next GT, it should be 115 correct, 125 correct. And then I'm going to go with 3 days of pharmacology, 3 days of microbiology, 4 days of PSM, and I'm going to write another grand test. And then there should be a further improvement of 5 questions. With every grand test, I will simulate the exam. I will think that I am sitting in the examination atmosphere and trying to see that where I'm going wrong. After this, pediatrics 2 days, orthopedic 1 day, biochemistry 3 days, medicine 5 days, and the psychiatry 1 day. With this, we will have a complete reading of all 19 subjects. And we are at 5th of April. On 6th of April, I will start my second revision, and I will start my second revision by writing another grand test again. Now, since I have already completed my course once, subject-wise, for a lot of students, you have already completed one before 15th Feb. I will have a decent knowledge of the subject. And now I will do fine tuning how I can grow forward. A lot of people ask me this, ki, sir, my marks have become static in the GT. They are not increasing. 120, I am doing 120 correct. I am doing 120 correct. And I am not be able to go forward on this. Now, what we're going to do after this is, I will write a grand test and I will analyze the grand test, and I'm going to see what are the 5 subjects in which I scored minimum. And whichever 5 subject in which you scored minimum, for the next 6 or 7 days, you're going to read only those subjects. You're going to read only those subjects because you want to gain more in those subjects. Okay. Then I'm going to write a grand test again. And then apart from those 5, you're going to select the next 5 subjects. Try that your bottom 5 in the previous grand test should not be the bottom 5 in this grand test. Okay. And then take another 5, then write another grand test, then take another 5, then write another grand test and take another 5. You're going to realize it that by the time the INI-CT exam has come, you have revised your course twice. One on the basis of question format, one on the basis of complete subject-wise format. Please remember, when you are following this, you have to develop this timeline that ENT, you will have to do your notes, you will have to do the images, and you have to do the question bank. That's all. In question bank, the first priority is previous year MCQs. And after that, if the time permit, you can do anything else. A lot of people ask me, sir, it is very, very monotonous for me to read one subject in one day. What you can do is, you can club the 2 subjects and you can break it. In the morning, you can read a subject in which you are slightly weak. In the evening, you can read the subject in which you are slightly strong. But please remember, this should only be done for those students who feel that it is monotonous for them to read one complete subject in a day. Okay, so that is what you have to do. All right. So after this INI-CT exam, what we're going to do is only notes plus questions. That's all. Notes plus question, notes plus question, notes plus question. We're going to write a grand test in the middle and then notes plus question. And then 21st May, you are having a NEET exam. So this is the broad schedule that I feel that one can follow. If you have already created your own schedule, obviously well and good. That is the best thing. If you are unable to decide a schedule for yourself, try to follow this, and I'm sure it will be very, very helpful for you. Please remember, focus, discipline, and a positive mindset. These are the only three things that will take you to the rank that you're looking for. I don't think there is anything else that is needed apart from these three things: focus, discipline, and a positive mindset. Dr. Nachiket, do you have any suggestions or anything or any special point that you want to mention on this?
I think, guys, again, Sir has prepared a very beautiful schedule for you guys, and with full heart, just follow it. That I would say, and please do not follow anything other than this. I am being very blunt over here because this is the last couple of months, and if you get swayed at this point of time, then the whole dedication and hard work that you have put in your work, we have put in your work, it is all going to waste. So at this point of time, I'm just going to firmly put my hand on your shoulder and tell you to just follow what we are telling you and follow it to the brink until the last minute. Until unless we give you something else, you have to follow this only. That's the whole point of this session.
And Dr. Nachiket, one point that you mentioned, it is extremely important to have a good start in the morning. Very, very important. Please identify a time at which you're gonna get up, and working for your schedule for the day will be very, very important for you, because sometimes what happens is that you work till late night, you are studying till late night, and then what is happening, your next day, entire day goes for a toss. So please have that schedule available with you. If you want our help, do let us know. If we can support you in your dream, we will be more than happy to do that. You can do it at your own. That's extremely great. All of you can do that. We are very, very sure. As far as these Excel sheets are concerned, we will share that with all of you. Don't worry about it. Dr. Nachiket, how can we share it with the students?
I think they can join the WhatsApp group that we have put in the chat section, and we will share the Excel sheet in that only.
So they can join the WhatsApp group, and the PDF version of these sheets, I will share it in the WhatsApp group. I think that's the best suggestion that can be be.
And I think I'll also add a couple of things here. I think apart from the academic, the non-academic things also help. If you are, I mean, I am the guy who cannot wake up at 6 a.m. So I never plan my day accordingly. I make sure that I wake up at 8 a.m. because that is only when I can work efficiently. That's my own, let's say, pros and cons deal. So I'll recommend that you have to understand what is your saturation point. 7 बजे उठता हूँ दिमाग खराब रहता है, 8 बजे उठता हूँ ठीक रहता है, और वीकेंड पे हाँ पार्टी चाहिए, तुम भी इंसान हो. So if you are going out and partying a single day in a week, that is not bad, because every brain needs relaxation. तुम भी उतना tired हो, you have studied 6 days a week. So अगर तुम्हें लग रहा है that you have studied 6 days a week and I mean partying 7 day, I mean I think relaxing 7 day is actually causing guilt. Please don't be. And if you have not done anything,
6 दिन बिना पढ़े 7वें दिन पार्टी कर रहे हैं तो they should have a guilt.
हाँ, if you have not studied 6 days, 7 day कुछ वैसे भी नहीं होगा,
है ना?
तो
अगर 6 days इतना पढ़ लिया कि आपको लगता है कि नहीं भैया this is my upper limit, I mean भगवान भी देखकर ये बोले कि यार ये तो इतना पढ़ लिया, इसको तो दे दो. तो 7
अगले मंडे से सोचना है कि that next 6 days you have to perform in 110% efficiency. That cannot happen until you take a rest break. So keep Sundays or one day in a week off for yourself. Talk to your family, go outside for a walk, catch up that movie. Otherwise that FOMO inside will kill you. और होगा क्या, तुम सिर्फ दिखाने के लिए पढ़ रहे होगे लोगों को कि हाँ यार मैंने एक दोस्त को दिखा रहा था मैं 15 घंटे पढ़ सकता हूँ 7 दिन. It's humanly impossible. भाई बड़े बड़े एथलीट तक एक दिन ऑफ लेते हैं because that's the need of your body. So consider and treat your body as an expensive car. You need a weekly service. सबको चाहिए यार.
Okay, so there are some doubts that
avoid fried foods please. मैंने बहुत बार देखा सर, अभी एक बच्चे ने मुझसे पूछा कि that बहुत
फ्राइड फूड से नींद बहुत आती है ना यार, वो तो I mean it's a known fact. मुझे लगता है कि डॉक्टर नचिकेत, I mean obviously अब हम तो बुढ़े हो गए हैं, you are a young person, you can tell it in a much better way. But what I feel is कि on an average at young age like you, 6 to 7 hours of the sleep is a decent sleep that is needed. What do you think? Do you think it is more than that is needed?
No, I think the sir at maybe 24, 25, it's very good. But it's, I think I was just giving an anecdote also. A couple of days back, a student messaged me कि sir बहुत नींद आती है. So थोड़ी देर बात करता रहा and I could not figure out what it was. So I finally asked him a very basic question कि what do you eat? सर भाई ये सुबह 4 पराठे चल रहे हैं, दोपहर में पूड़ी चल रही है, and that feeling is because
रात को
he was
11 बजे
studying
भी
the
तो चल
whole
रहा
day.
होगा कुछ।
हाँ, भुजिया चल रही है साथ में. सो एट द एंड ऑफ द डे आई फाइनली रियलाइज कि दैट यार मैंने कहा कि गलती भी नहीं थी. आई नो सो मेनी स्टूडेंट्स, क्योंकि जब भी हम भी जब पढ़ाई करते थे ना, तो अब पूरे दिन में आप पढ़ रहे हो तो एंड में जो खुशी ढूंढते हो उसे खाने में बचती है कि काम करते बढ़िया से पराठा खा लेते हैं.
Make the study enjoyable. I mean, when your dream is very, very near to you, na, I say that studies becomes enjoyable. I mean, the point that happens is that we are unable to visualize that dream. That I still remember I used to dream that if I'll get rank 1, I still remember ki our counseling used to be at Patel Chest, which is and that too on the 6th floor. And so do you know, I used to dream that when I will get rank 1, I will go from the stairs to the 6th floor, and once I will come down, that the people were congratulating me. And do you know that feeling of that thought that used to come to my mind, अगर मैं deviate भी हो रहा होता था ना, वो thought मेरे को वापस ले आती थी. So I mean, all deviations, distractions, all these are a part. And what I agree, I will not say 100%, but to some extent I will agree. Yes, if you want to take a break, you have a girlfriend, you want to take him for a dinner on once in a week, that is absolutely. You have a boyfriend, you want to take him for a dinner. A lot of time people say, why? I don't know. You have a boyfriend, you want to take him for a dinner. You have a very close friend, you have a family member, you have a birthday of your father, and you have a marriage. That's absolutely okay. But compensate that in the week. Compensate that in that particular week, and that is why these schedules are needed. Now, what we can offer you, bache, at DBMCI, we are there for you people. What I say to everybody, ki please you walk and I am standing for you. Okay, I will make sure that you will not fall. Wherever you need us, we are there for you. If you don't need us, we are standing behind for you. That's all. That is my simple philosophy. And when I'm saying simple philosophy, it's a simple philosophy. You say, sir, I can read at my own. Please do that. You say, sir, can you give us test series? We have the test series available for you. Sir, can you give us short videos? We have last minute revision point program, which is a very, very good program for you. Sir, can you help us with the images? We have Vibe program available for you. Sir, can you give us test series? We have test series available for you. Sir, can you give us motivational programs? We have motivational programs available for you. Whatever you need, we are there for. We have that program available for you. You don't need it. We are there for you. We are standing behind you to help you. If you will fall, we will hold your hand. That's all. And that's the predominant motto that what we believe in. No matter what anybody says, that's the philosophy that we have taken from Dr. Mukesh Bhatia also, and that is the same philosophy that we are following it in the future. Yeah, sometime we get busy at one place, at another place. Again, that's a part of our life, but we are available in every possible scenario that we can do. As I told you, that we have got the purpose of our life, and that is to change life of other people, and that's all. And that's the philosophy with which we are going forward. So do let us know if anything else is needed from our end. If somebody is unable to complete the subject, they can read from last minute revision program. So there is a combo which is last minute revision program plus Vibe plus test series that is available. If you want to join that, you can definitely join that. Maybe Dr. Nachiket can tell you in detail about that particular program. Dr. Nachiket, over to you.
Yes, sir. So basically, guys, it's a simple plan where we are giving LMRP plus Vibe. So LMRP are the short video revision videos. Vibe are, of course, the image discussion videos, and test series, that's by name, right? So this package is being given. For details, you can just join the WhatsApp group that we have put into the link. Please arrange a session for those students who are moving from second professional to third professional. Yes, we are going to keep professional wise sessions very, very soon. And we are going to discuss the whole strategy over there. And talking
Dr.
about
Nachiket,
the
let
LMRP
us
plus
make
Vibe.
a routine way. Let us do a program that every Tuesday 9 p.m. we're
Yes,
gonna
sir.
do a live session.
I think it is just motivation for us also. I mean, when we see so many things, it helps us plan the next step कि हम तुम सबके लिए और better क्या कर सकते हैं. So talking about the LMRP plus Y plus GT, so we have made a 3-month plan dependent on basically targeting the May exam. So you can very well subscribe for that, and you will be getting grant test in that itself. So there will be no other grant test series. There will be only one single grant test series, and that will be in the test series pack. So if you're looking for grant test from Bhatia, you have to join our basic plan or this particular combo plan that I have given. Okay, so Heather, Bhatia schedule 20, please advise accordingly. I think that has
That
been...
I will see. That I will see. Don't worry about. If somebody is enrolled with our regular programs or in a live face-to-face classes or a live internet-based classes, don't worry about it. We're going to take care of you.
So what to keep in mind if main priority is INI CET over NEET? I don't think so that अब तो तुम्हारी कोई अलग रह ही गया है. I think sir कब है INI CET?
8th May.
8th May ना. So do you think that it will, there's a chances that it will get postponed or 8 को ही रहेगा?
No. वो the student is asking broadly कि अगर 8 मई में INI CET को प्रायोरिटी रख के चल रहा हूँ तो मेरी स्ट्रैटेजी में क्या चेंज होना चाहिए? बच्चे कोई चेंज नहीं होना चाहिए. But I think that at this time you should be able to score more than 450 marks in the GT. That is my genuine suggestion to you. If you are scoring less than 450 at this time, ideally 500, but if you are scoring less than 450 in the GT at this time, please consider NEET as your priority rather than INI CET. Okay, that's an honest suggestion to you. And if you're already scoring more than 500, only difference is that rather than the 3 revisions, you will be doing 2 revisions. If you're scoring more than 550 marks in the GT, rather than the subject wise, you can do the integrated reading. That is another change that you can do in your studies. Just focus on previous year MCQs, previous year topics, more and more of GTs, more and more of questions. And in whichever question you stuck, do a retrograde reading of that particular topic. But that is only if you are scoring more than 550. If you are scoring more than 550, you can also add First Aid in your preparation, which is a really, really good book. But again, only if you are scoring above 550 at this time. If you are scoring 200, 250, your aim is to qualify the exam. Please do not unnecessarily increase your burden. And let us be very, very clear. Let us be very, very focused about my thought or about my actual goal. As I always say, that do not live in a pseudo world. Live in a real world. है ना? Pseudo world क्या होता है? Pseudo world होता है I am scoring 40 questions correct at this time, and suddenly somebody says कि how in the next 50 days or in next 70 days you will get more than 680 marks. And that's a pseudo world. That is not possible. I mean, I can tell you that is not possible. But if you ask me, sir, can I have an improvement of 200 marks in the next around 100 odd days? The answer is yes. 200 marks improvement is very much possible. Or maybe you can go 200 to 250 marks improvement is very much possible. Okay. 500 marks improvement is not possible in 90 days. And it's as simple as that. From 200, you cannot move to 700 in the last 90 days. That's my thought process.
The question is, sir, I haven't completed watching biochem anatomy surgery. Should I go for LMRP videos or e-Gurukul videos? How to manage these subjects at this time?
LMRP will be a better choice at this time rather than watching the complete videos. But if you think that your other subjects are very, very strong and you're only left with these 3 subjects, you can watch the complete videos also.
Sir, how many marks should come in a grant test currently?
But that totally depends. What is your aim?
How much correct should be targeted in GT?
Dr. Nachiket, that's totally dependent on an individual student. Aapka aim kya hai? And that is why I'm saying that come into the real world. Don't live in a pseudo world. Student come and talk to me honestly. They say ki sir, mera aim hai qualify karna. We guide them accordingly. There are people who say, sir, mera aim hai to get a rank in top 100. We guide them accordingly. One size does not fit all. People say, sir, my aim is to get a government college seat. We guide them accordingly. So obviously it will differ. If you want to qualify, आपका जो target rank है, जो target score है, that is different. If you want to get a rank in top 100, your target score or a target rank will be different. So it's very, very difficult to do that. And that is why what I suggest, बच्चे, don't compare yourself with other people. Try to be a better version of your yesterday. Always do that. This is what I have always done. I have never compared myself with anybody. I am my biggest competitor. And what we say, your mirror is your biggest competitor. Whatever you knew yesterday, you should know more than that today. Whatever you knew yesterday, you should know more than that today. Every day in the night, talk to yourself for 5 minutes and ask yourself, have you utilized your day in the best possible way? If the answer is no, please try to change that thing in the next day. And then suddenly you're going to realize that your productivity is increasing, the way of thinking, the way of thought process is increasing, the positive mindset is increasing. And you have to just follow on all these things, and suddenly you're going to realize that gaadi patri par aa rahi hai. Your train is coming on track. That's all. That is all from my side.
So I think I'll just give a quick answers. Ravi Raju Pavulvuri, I'm so sorry about that pronunciation. See, all the grant tests, the NEET PG boost and everything is now available only in basic plan. So we are launching a Together We Can test series, which is going to be revision test with around 7 tests currently. And that is free for all students of Bhatia and e-Gurukul who have test series in their plan. So if you want to be a part of that test series, of that test, Together We Can test, that is like NEET booster plan only, you can join the basic plan. All right. Okay, please add more grant tests in e-Gurukul app. No name, my friend, we have added almost 10 grant tests recently. Okay, GT series every Sunday, uske andar we have given almost 80 grant tests in the app, if you go through that. All right, so is legendary TND available to NEET exam? No, I'm sorry, you have to extend, you have to go and extend your program and you have to pay the extension fees. Sir, daily motivation session of yours get collapse easily at the end of the day. Sir, ये तो sir बता पाएंगे अभी?
There are a lot of different programs that we run. अभी हमने एक special revision program that we are already running. In the special revision program, there is a provision of having a morning 15-minute session where we do a Zoom session and interact with the students on a daily basis, that what they should do in the day and how they can utilize the day more effectively. I mean, there are different kind of programs that we have. As I told you, that we are standing with you wherever you need us. Please contact us, and all these details will be made available to you.
You can just visit us at egurukulapp.com or 9810150067.
TND, एक क्वेश्चन है सार्थक का, is TND a good way to go through the revision right now? Very good way, Sarthak. If you have already completed your reading once, TND gives you a good opportunity to stay on track. If you can join a TND course which is finishing the way it is doing that I told you, you can jolly well join that also, or you can create your own TND. As I told you that I have already given the schedule for it. At the end of that particular day, which you have decided for that, you write a subject wise test, and that becomes your TND. That another thing that you can do.
We are of a recorded fast track TND. We are planning that also. You can join the WhatsApp group and we'll give the details over there.
And the same schedule we can apply.
Yes, absolutely.
That as
Okay, and eGurukul 3.0, we are going to launch pre-launch from 14th or 15th of February itself. It is going to have new features. It is going to have English and English videos, multiple login, Quizzy, the best feature that we have seen in all the apps currently, concept videos for first and second professional students, and the biggest, it is going to have a complete new Q bank with integrated videos in every subject. So you have to wait for a couple of days because we are going to drop ultra low pre-launch prices very soon. How many people attend eGurukul GTs? 2, me and him. आपस में compete करते हैं. Is the new TND batch coming?
1 minute, I can give you a value. Okay, like that. I mean, there are softwares available which can show you the results from 5 lakh. Okay, all that matters is that how you are attempting that particular exam. Your mirror is your biggest competitor. Please, whenever you are writing a GT, see where you went wrong, which question you could have done right, which you did wrong, and what you should do so that you don't repeat that mistake in the future.
So what about previous year questions? I mean,
the single most important thing that the student should pay attention to is a previous year topic. I remember my senior told me once कि रजत, मेरा पढ़ने का एक तरीका है, एक क्वेश्चन जो पहली बार कभी एक बार आया है एग्जाम में, उसका आंसर याद कर लो। एक टॉपिक जिससे 2 क्वेश्चंस आए हैं, वो टॉपिक पूरा का पूरा कवर टू कवर कर लो, यू आर गेटिंग अ ग्रेट रैंक। That's all. I mean, see, these are standard points that we keep on telling, and I think everybody is aware about these things. It's not like something that we are telling some rocket science over here. Is everybody is aware about these points. All that matters is who follows and who does not. That's all. If you can follow it, very well. If you want our help, do let us know. We are there to help you. Okay.
I think you should very well control your negatives in grant tests. I have seen students knowing 100 questions and after that marking, I mean, wrong and due to intuition. मुझे पता सर तो टॉपर रहे बिकॉज बट आई हैव बीन एन एवरेज स्टूडेंट, तो मुझे पता है तुक्के की वैल्यू क्या होती है।
तो ऐसा है ना डॉक्टर नचिकेत, वी विल हैव सेपरेट वीडियोस ऑन दैट बिकॉज़ आई थिंक योर एंड माय ओपिनियन विल नॉट मैच ऑन दैट।
तो आई थिंक जो रैंकर्स हैं वो आई मीन जो सर का लेवल है वो रैंकर वाला है, बट मुझे लगता है कि दैट एन एवरेज स्टूडेंट की थिंकिंग थोड़ी सी अलग होती है। सो वी आर गोइंग टू हैव अ सेशन एंड आई थिंक वी आर गोइंग टू हैव अ डिबेट ऑन दैट। we will both present our points and you choose what you have to do, and उसमें दोनों का फायदा। I am
Let's
the
have
one
a debate on this whether you should keep your attempt high, because I'm a positive person. Nachiket is also very very positive person. I will not say on that.
Yes, sir.
But,
I mean, you have always been the person who is more studious, so you are more aggressive because you know the subject more. I have been the person who has been an average student. So I am right now, if I see that how I am moving forward, it's because I'm a little bit defensive. Because I know that, okay, I may not have that command of the subject, but if I can not score 4, but yet save 1, let's save that 1 first. So everybody has a different technique. So if you are an average student who is willing to qualify, I think that particular strategy can work. And if you're a person who's above 500 and 600 ranks, waiting to score 700 and above, I think such strategy is fantabulous in that.
Yeah, I think I agree with you on that front. Ki your thought process and your goal should be absolutely clear. See, I still remember there was a student, Dr. Krishna. He got rank 11 in INI-CET. He was student with us at Bangalore Center. After he got 11th rank, he told me one thing, कि सर मैंने ना INI-CET का पेपर कैसे अटेम्प्ट किया था कि या तो अच्छी रैंक आए वरना ना आए। I did not want to stuck with a rank of 200 because if I get a 150 or a 200 rank, the problem is I am stuck. समझ नहीं आएगा क्या करूं, लेनी है छोड़नी है क्या करनी है, तो या तो आए वरना ना आए। तो he got rank 11, he did radiology, he's completed radiology now. I mean, he finished it in December only. So the point is, I mean, stay positive, identify that what do you want, है ना? I mean, your aim is to qualify the exam, and please, one more point is that never underestimate on this particular part that if you want to qualify the exam, you are somewhere inferior from the person who is aiming to get a rank or 650 or 6 or 700.
Keep your rank with yourself. That's the biggest.
Mark my words on that. I can tell you that I am into a medical profession for more than 2 decades now. In the long run, it does not matter whether you are a topper of your batch, which subject have you done, from where you have done, it does not matter. What matters is how hardworking you are with your subject, how determined, how passionate you are to take that thing forward. And then anatomy is also very good, pathology is also very good, radiology is also very good, medicine is also very good, orthopedic is also very good. And if you do not have a passion to do your branch, to your subject, everything is waste. We have seen people committing suicides in radiology, in medicine, in orthopedics, in OBG. And on the other hand, we have seen people with clinical branches, for that matter, non-medicos are living very, very happily in the world. So it's all about the passion that you have. So do not underestimate yourself. If you are thinking that नहीं यार मैं तो एक private college लेना चाहता हूँ, तो क्या हो गया भाई? My father has earned the money for myself. I am working hard for myself. It is not trust me on this particular part. I mean, obviously it is good that you can score the things, you can get as higher rank, as higher score as possible, but please do not demean yourself. Identify yourself that where you are, what are the resources that are available for you. Your parents can afford a seat. They have done the hard work for you. I mean, it is your luck that you have been born in such a family. It's as simple as that. Your parents have worked for you. You have all the right to use those resources. work hard in your subject, and be a great doctor. That's all. I mean, that is my simple an opinion on this particular part. Yes, you can work very, very hard. You can top the exam. Obviously, you will have more confidence. You're gonna have it. But please do not demean yourself. Do not underestimate yourself in any form. Identify कहाँ पर बैठे हो. हाँ, unnecessarily अपनी family को push करना कि नहीं नहीं नहीं, they cannot afford, and you're forcing them to do कि नहीं नहीं मुझको तो ये seat दिलाओ. That is something that is, I feel, is not logical. We all are have reached to an age where we have we can understand on all these aspects. Okay, so that's all. I think Dr. Nachiket, let us stop. A lot of students are waiting for our
Absolutely, sir.
previous year MCQ based quiz, which is Kahoot. So all those students who are struggling with the previous year MCQs, you know that on this YouTube channel we do this Kahoot quiz, which is based on previous year MCQs. Every day we give 20 questions from different subjects which have been asked in the last 4-5 years in various INI, CT and NEET exam, which you can play as well as learn. So it's a fun way of doing the previous year MCQs, and by the time your exam is going to happen, we will complete all the 4 and 5 years previous year MCQs of the INI, CT and NEET exam. So we stop. Thank you very much for your time. Do let us know if we can help you out in any way. We will be happy to help you, and do join us in the Kahoot session another 2 minutes. Okay, take care.
Thank you, everyone.
And may God
Take
bless you
care.
all.
Bye bye.